Doctor, you have been I want to say, first of all, let me thank you for all of the support that you gave the health science system in the legislative session when you were there.
Thank you.
It's very important.
What's
and
that
I know you're really interested in healthcare here and everywhere else. Tell us a couple of the problems that we have in the healthcare system right now, understanding that I'm sitting here looking at you, having listened to all 8 hours of the debate last week in the legislature, the federal government legislature, and I don't know very much about it after listening to it. So tell me about it.
Well, I think one of the biggest problems we have is the inability for people to access timely care. And so what happens then is they usually wind up in a hospital emergency department, place where I work, and actually the only place that's actually mandated to take all comers, regardless of ability to pay, time of day, acuity of illness or injury. You know, you come to the emergency department, you're going to receive compassionate care. That's what we do.
So you have to be close to death or something like that before you have to take them.
Well, and we have to see everybody regardless. I mean, even the person who comes in with the runny nose to the emergency department will be seen. That's required by federal law. But what we see, both sides of the coin, we see those folks that wait too long to get medical care because they feel they can't afford it or they don't have health insurance, and so they wait until they're so ill that they present to the emergency department, which is very costly for them to be taken care of now at this time of great need, a high medical resource utilization. And then on the flip side, we see those who tend to overutilize the emergency department because they don't have a primary care home, a personal physician that they can go see. So they come to the emergency department for the runny nose, the sore throat, the toothache, things that really jam up the emergency department, increase the cost of providing health care to everyone, and may actually delay care for those who have more urgent needs because beds are occupied by individuals with minor illnesses or injuries.
Of those two, which is the greater problem, do you think?
I think that we see here in Southern Nevada, I think we see more of folks waiting for care and coming in when they're much sicker rather than getting routine care or being taken care of earlier. Now, don't forget, I kind of have a bias or a skewed view. I work at the county hospital, so we certainly see a larger share of individuals that don't have the ability to pay. And so they wait for quite some time, and they come to the emergency department, the diabetic, the high blood pressure, the person with heart disease, when they're having significant symptoms because they've been putting it off for so long.
How do you resolve that issue?
Well, you know, those folks that are coming to the emergency department with critical injuries or illnesses that have delayed care, we have to get them into a medical home. We have to provide them some way to receive ongoing medical care on a routine basis so that the individual, let's say with diabetes, is getting the monthly checkup and they're having their sugars under control rather than waiting until they are ill or run out of their insulin and then they come into the emergency department in some type of crisis. And so it's being able to get people into a medical home and providing them some type of coverage. And obviously that's the debate that's going on in Washington now, is how do we cover the 15% of Americans that don't have coverage? And that's a critical issue.
Do you also find that you just get people who just wait too long for medical care, regardless? And so we've done a very poor job of educating the public on how to take care of itself?
Sure, this is not a problem that's unique to those without insurance. We see people with insurance that tend to want to put off coming to the hospital. They have symptoms of a stroke, but they're trying to negotiate in their own mind that they'll be okay. Or they're having chest pain and they think it's indigestion. And so they wait and put it off until they finally become so ill that they have no choice, and they come to the emergency department at that time. And then it's much more difficult and much more costly to take care of them.
And you hear people talk about, I went to the emergency room and they had them lined up in the hallway and they couldn't see me for 6 hours. In the meantime, something really tragic happened to me. So it's not a minor problem.
No,
it's a major problem.
It's a critical issue, and it's very critical in Southern Nevada, especially because we have the mental health issues that we see, and so there's a lot of mental health patients that are in the emergency department taking up beds because we don't have the level of mental health services that are required to care for our population. We have the overutilization by individuals that have no medical home. We have people that show up critically ill and injured because they put off care for too long. And you put all those things together, and it's a perfect storm for a healthcare crisis.
Tomorrow, let's talk about how you solve the problem.
Great, thanks.
Thanks.